Hi, today we are going to do an advocacy meeting on increased price of prescription medication. Hello, my name is Lana Tran, and I would like to thank you, Ms. Smith, for taking this time to discuss with me this issue. This has been a long-standing issue with the network hospitals that I am working with. The issue I would like to discuss today is the increased cost of prescription medications for our vulnerable population.
Hi, Lana. Yes, my pleasure. Please, tell me a little more on your issue.
I would like to introduce my program called the Prescription Medication Task Force with Providence St. Joseph's Health. I am a nurse care manager with the organization.
That's wonderful. I'm sure a nurse is the right discipline for this issue.
Thank you. With this Prescription Medication Task Force, we want to be able to help the poor and vulnerable to stay healthy in regards to being able to pay for their prescription medications. If they are able to afford them, then they will be taking them. On a yearly basis, the cost of copays on prescriptions have been increasing.
This is a good goal to work towards. The cost of increased copays on prescriptions medication has been an issue for a lot of people.
Yes, we started this task force about 2 years ago. We have helped a number of patients, mostly the Medicare population, to be able to navigate their insurances and work with the pharmacies to be able to get their copays down to a reasonable amount.
This is very interesting.
I would like to give you an example of how our program works. We have a patient named Susie that comes into one of our hospitals because her atrial fibrillation disease is out of control. She states that when she is on her medications, she is fine. Since the new year started, the copay for her medication have almost doubled. Initially, she was trying to conserve her medications by only taking it every other day. Eventually, she stopped picking up her medications altogether because she was having to use her savings to be able to pay for them. She has let her atrial fibrillation get out of control by not taking her medications. The doctor had to put her on a medication that requires a prior authorization and justification by her insurance, or her copay would be high. The case manager in the hospital got this medication approved for her before she left the hospital. Susie is connected with a case manager when she left the hospital. The case manager has reviewed all her medications and touched base with Susie after she comes home to make sure she is able to afford them and continue to take them as prescribed.
The care Susie received sounds very in-depth.
The reason I tell you this story about Susie is because there are a lot of patients who won't pick up their prescriptions because they simply are unable to pay for them. We have developed a task force comprised of nurse care managers to go through data of high-risk patients who are on more than 5 medications. The nurse will make the initial outreach call to the patients and go through their medication list. She will make sure the patients are taking their medications, and if they are not, what are the barriers?
This sounds like a huge project.
Yes, our nurses have enrolled a lot of patients onto this program. After confirmation of the patient being stable on their current treatments, they will be discharged off the program. There are a lot of collaboration between the nurse with the patient and their doctors. We have been able to prevent multiple emergency room visits by being able to break down some of these barriers to get the medications for the patients approved through their insurances.
Great. What happens if the medications don't get approved through the patient's insurance?
If the care manager is unable to get the copay down, she is asking the patient's primary care physician for an alternative medication that is covered under the patient's insurance. The nurse care managers are collectively working together with the patient's primary care physician to prevent any ER visits.
It sounds like it. How can I help you with this issue?
The reason I'm here today is to seek your support on Bill H.R. 3 that was just presented to Congress a few months ago. I would like to push for it to pass to be able to cap the out-of-pocket cost at $3,100 yearly for our Medicare recipients. By passing this bill, it would allow our seniors to be able to care for themselves medically and financially. The second part to this bill is to provide rebates back to Medicare if the drug companies choose to increase their prices more rapidly than the inflation rates. I have heard that you have an interest in this bill.
Yes, this bill is one that I've been following. It was just presented to the House and it and is still being reviewed. These types of efforts have been taking a long time to see advancement to the next level.
I am trying to expand our program to enroll more patients to support this vulnerable population and keep them healthy. I would like to be able to see this bill get passed to help make our jobs easier as nurse care managers. I am planning on having a forum to get these patients to understand this bill. I would like to invite you to this forum to answer any questions for these patients.
That sounds great. I am attending weekly hearings on this bill. I would like to come and meet the population who deserve to get this bill passed.
Ms. Smith, I am passionate about this work and task force. I would like to leave you with my flyer. It illustrates what we do for this population of patients. Thank you again for your time on this matter.
My pleasure.